This is a priority 1 call.
So we're on our way to a call ID metro station. There's a 30-year-old woman who's unconscious and having seizures. We're downstairs in the metro where the woman is having a seizure and unconscious, and now we are going to meet up with the ambulance team to see what the status of the patient is.
The patient is a known patient of our services and from the police department as well. And apparently she knows her condition. So it's her normal seizures. And so she refused any medical assessment, any medical evaluation from our paramedics.
I'm in a paramedic vehicle right now with Supervisor Jean-Marie Dufresne. We are going to be going around downtown Montreal, and we are going to be focusing on what it's like to be a paramedic when they have to respond to many calls. We have ridden along with paramedics before, but their challenge is changing, especially in Montreal's downtown. More and more calls are coming in related to people in distress. Overdoses, intoxication, and mental health crises. Many related to homelessness, and many involving increasingly complex situations.
It's getting very creative. I have heard stories about shoe polish being melted and drank, rubbing alcohol, anything that you can, windshield washer to a certain extent even does have some level of alcohol in it. So whatever is drinkable usually will be consumed.
Urgences-santé receives about 1,000 calls per day, and 10 to 15% of those calls are for homelessness interventions, drug overdoses, or intoxication.
Anything with a fentanyl base is very popular right now in Montreal, pretty much anywhere in the world.
Quebec's Public Health Institute says the number of deaths linked to suspected opioid or other drug poisoning surged by 33% in 2024 compared to the previous year. In 2024, Urgences-santé administered naloxone, a drug used to reverse opioid overdoses in 1,000 cases in the Montreal area. Of course, paramedics respond to other emergencies.
Motor vehicle accidents, heart attacks, people stuck in elevators.
But they also spend plenty of time on calls which turn out to be less urgent.
We are heading to Bennett Street in Hochelaga section region for a man about 60 years old, unconscious. We got called for an unconscious patient, and at the end of the line, the patient is constipated.
So this is one of the areas you get calls about, but
Yeah.
not for the reasons that one would think.
No, definitely not. There's a statue that's sleeping, quote unquote, on a park bench, and just going up to it and, oh no, okay, that's fine, that's a statue. By law, 911, as soon as we get a call, it's mandatory for us to respond.
Yes.
So we will respond, lights and sirens.
Calls to intervene on homelessness, drugs, and intoxication used to mostly come from the downtown core. That's not the case anymore.
A bit everywhere on the island. It's beginning to exacerbate. Our resources are being stretched.
We reached out to Quebec's health ministry, which told us the situation is evolving rapidly and is complicated by the fact that the substances contributing to overdoses are multiple and that the illicit market is evolving rapidly, particularly with the availability of highly toxic substances. Both the Quebec government and Montreal Public Health pointed out to recent efforts and resources made towards harm reduction, addiction prevention, and treatment.
We're really here to help. People's health and welfare is our main preoccupation. So, we don't wish harm to anyone, but as paramedics, we wish to be the ones that are called, and we wish to be the ones that basically save your life.